The use of AI by consumers in healthcare is the biggest, fastest change we've seen in hundreds of years in how people access healthcare. So, what I'm really interested in is not just what it means in the short term for consumers today, but what it's going to mean for our entire health system.
Ben, we know that people are using these tools to check symptoms, but I suppose what comes next? What comes after that?
I mean, I think it's the transition from chat to agents I think, what's really interesting. So we're going to go from a world where, consumers are just, corresponding with large language models, checking their symptoms, understanding their diagnoses, etc., to a role where they have a health agent, an always-on health agent that not only can they, ask it questions, but they can connect it to their data, whether it's from their wearables or whether they're granted permission to have access to their results and their health records, etc., and can create a really sort of integrated, always-on health advisor that gives you advice about diet, about exercise, about sleep, about all those things that are actually genuinely related to your underlying health conditions and circumstances. And then potentially can move from there to make appointments for you, to arrange healthcare checkups, to prompt you to get your immunizations, prompt you and make appointments for you to do things that are important for your health. I think that sort of always-on health advisor function is a really interesting one, and there's some really interesting questions about whether that's something which in nationalized health systems is provided by that national health system, or is it something which is a private sector competitive choice, or how do you regulate that? How do you manage it? How do you license and assure it? I think there's some challenging questions about how those agents will access private and confidential data, and what sort of security and confidentiality will be provided alongside that. But the future of AI is definitely agentic. And so I think that, the next step is how people's personal health agents, their personal doctor in their pocket, will start to evolve.
Where do you see the biggest opportunities here? Diagnosis, navigating healthcare, booking appointments?
I think this point about health literacy is actually the most important one. Mm-hmm. There's fantastic research that shows if people have access to their own healthcare records, to their electronic health record, to their written health records, and in particular, if they can combine that with contextual advice about their diagnoses, their treatment recommendations, their pathways, their options, then people are much more likely to firstly identify errors in their treatment path. So people reading their own records can see something's been recorded wrong here. They can raise that with their clinicians, and that gives them more likely to get onto a good treatment pathway. Secondly, they can understand what it is and what they need to do. And so we see much higher levels of compliance with treatment recommendations, consistency of taking medication, etc., if you have access to your own records. And thirdly, people are better able to understand what they should do if their symptoms change or worsen, etc. So the idea of being able to pair an LLM with access to your own health records can give you that contextual advice and that better understanding. And we know that that leads to substantially better health outcomes, and in fact, more equitable health outcomes.
If we get this right, what do you think this will look like in years to come? The biggest opportunities, the biggest benefits, patients, providers, payers, everybody.
So I think at the core, there's the opportunity here to really make progress on the sort of value-based healthcare agenda. And so moving away from just measuring we did these surgeries or we had these number of visits to doctors, to actually saying, have the health outcomes of the population as a whole been enhanced on the basis of what we've been doing? And so how does AI contribute to that? Firstly, I think it allows a better understanding in the hands of everyone about what the known evidence-based pathways are. What's the modern best practice treatment pathway? Secondly, I think it helps with the collection and analysis of data. Now, it's good to collect all that data, but artificial intelligence, machine learning are incredibly powerful in helping interpret that and drive it. But then thirdly, you need to serve it up in ways that are actionable to people at the point in time when they need it. And I think, that starts to become more feasible and more possible with AI. So that helps payers because they're paying for stuff that works. It helps patients because they're only, they're getting the best treatment pathways. And it helps providers because I think it helps them focus again on what really matters. It helps take toil away from their work, the sort of gatekeeping exercises that a lot of doctors and nurses have to do just to manage processes and order tests and so on. There's a lot of administration that goes on. Again, a lot of that, they can be relieved of a lot of that activity.